Well, good day everyone, good afternoon. Happy New Year to everyone who might be here with us at Parliament or watching live around Queensland. Thanks for joining us. I'm with Dr. Jeannette Young this afternoon, Queensland's Chief Health Officer, to update you on a number of issues. Firstly, Tropical Cyclone Imogen, or as it is now, ex-Tropical Cyclone Imogen, that of course crossed the Queensland coast earlier this morning. Near Corumba. It's now been downgraded to a tropical low. I was briefed earlier today by the Police Minister and Emergency Services Minister Mark Ryan, the Police Commissioner Katerina Carroll and the Deputy Commissioner, and also State Disaster Coordinator Steve Golcheski on the status of the now tropical low. We've seen minimal damage to property, which is a great thing, but there are power outages in the far north of our state, impacting on around 1,400 Queenslanders. They're living in communities such as Normanton, Corumba, Doomadgee and Mornington Island. Ergon Energy is working very hard to restore power to those communities. I understand some power has been restored to Mornington Island and that work will continue. There are crews that will be flown to that part of the state to ensure that. A helicopter is running the power line, the big power line up there, to see where the fault is, and we hope to get that power on as quickly as possible. So to those Queenslanders living in the far north of our state without power, this is not the best way to start the new year, we know that, and we are going to work as hard as we can to get the power restored to you as quickly as possible. Of course, that tropical cyclone is impacting on a number of roads in the far north of our state. There's a number of roads that have been cut due to flooding, so all drivers are asked to be very careful and to check before you drive, and of course if it is flooded, forget it. There's been a number of very sad and tragic events around the country at the start of the year, and we don't want to see any of those events in Queensland, so please take care if you're on the roads in the far north. The ex-tropical cyclone is now forecast to track slowly across the base of Cape York to the east coast. And of course we'll continue to monitor that through the Bureau of Meteorology and of course local disaster management groups who are doing great work on the ground. And I want to thank mayors and those LDMGs, including Queensland Police, who are working hard to keep the community safe. Secondly, onto COVID testing. I can report that there are 5 new cases in Queensland today, 5 new COVID-19 cases in Queensland. All of those are related to people who have returned from overseas and are in hotel quarantine, so there is no community transmission in Queensland, which is always a terrific thing for our state. Can I thank the thousands of Queenslanders and interstate visitors, especially those people from Victoria who have heeded the call to get tested. Can I thank people for their patience in getting tested, but can I assure Queenslanders and others that we are providing more testing facilities for them. We've opened more clinics on the Gold Coast, on the Sunshine Coast and in Brisbane. Clinic hours, these are Queensland health facilities, can I say. Operating hours have increased. I know on the Gold Coast they were operating till 10 p.m. last night. They started again at 6 a.m. this morning. We've increased staff in those clinics. Some staff numbers have been doubled in those clinics. So we are working very hard, and of course we've got all of the private clinics now operating across Queensland. So Queensland Health has 83 clinics that are operating, fever clinics operating around the state. 23 of those are in the southeast, and of course we've got many more in the private sector that are operating. Can I say there'll always be some delays from time to time in getting testing, but we're seeing those queues, as I'm advised today, being reduced, and we're also getting testing results back to people on average in around 24 hours. So can I thank Queensland Health staff in particular, who worked extremely hard over the weekend. They've done a wonderful job. I want to thank them and commend them for their work, and thank Queenslanders in particular for responding so positively to the call to get tested, and I thank them for that. And that's keeping not only those Queenslanders and their families safe, they are keeping the rest of our state safe as well. Can I also say to Queenslanders that complacency is the enemy and vigilance is our friend. So the more that we can be vigilant about this virus, the better it will be for all of us. And can I thank Queenslanders for getting tested. If you've got any symptoms at all, please get tested. Please maintain hand hygiene. Please maintain social distance where and when you can. That's the way we'll beat this virus. This virus is a wicked thing, as we're seeing in places like the United States and the United Kingdom. 57,000 people infected by the virus yesterday in the United Kingdom, hundreds of people passing away, and of course we are staying on top of the virus because Queenslanders are responding to the call to be safe and to stay safe. I might hand over to the Chief Health Officer to say a few words, and then happy to take some questions on any of those issues. Thanks, Dr. Young.
So, as we've heard, that we had those 5 new cases detected in hotel quarantine after returning from overseas, and that emphasises yet again the importance of keeping a very secure hotel quarantine process in place for Queensland. We now have 17 active cases in Queensland, which means 1,260 people in total have been infected with this virus. Yesterday we did 6,296 tests, and I thank every single person who came forward yesterday to get tested. So those are Queenslanders with symptoms. Any symptom, it's really important to immediately come forward and get tested. And I've also asked anyone who has been in Victoria since the 21st of December, whether or not they've got symptoms, to come forward and get tested, because we know they do have an ongoing outbreak there. And in the last testing period, they saw 3 additional cases, all linked to that restaurant in Black Rock. So they've continued to have all linked cases, which means we don't need to change our arrangements that we've currently got in place with Victoria, but we need to keep a very, very close eye on what is happening there. And I recommend very strongly that any Queenslander intending to travel down to Victoria just reconsider that need for travel. And if you do need to go, make sure you keep fully aware of what is happening in Victoria and Queensland's response, so you don't get caught out and potentially need to quarantine when you return to Queensland. At this point in time, there is still movement allowed between Victoria and Queensland, but we all do need to be aware of what's happening. Then New South Wales didn't have any cases in their last reporting period, but subsequent to that they have had 2 come forward this morning. But again, they are linked cases. They're linked to their Baralla outbreak, which is within Greater Sydney, so we remain closed to people who've been in Greater Sydney within the last 14 days. Of course, Queenslanders can come home, or people permanently relocating to Queensland, but they will need to quarantine in a government hotel when they return. That's very important while we continue to see these cases happening in Greater Sydney. To date, though, all the transmission has been in Greater Sydney, so that's Wollongong, Blue Mountains, Hawkesbury and the Central Coast and all of Sydney. So therefore we do not need to at this stage reconsider that border closure and make it any broader. But again, anyone travelling down to New South Wales should just keep alert to what is happening in New South Wales in case there needs to be a change to any of the recommendations for restrictions at the border. At this point, there haven't been, so people are still able to travel to regional New South Wales, but not that broader Greater Sydney area. So we do have 83 public Queensland Health Fever clinics stood up across the state of Queensland, and today we have now seen the private sector reopen all of their clinics, and the Commonwealth has stood up most of their Commonwealth funded and run clinics. So there is a lot more testing capacity now available across the state. We've also increased the hours of opening and the numbers of staff in a lot of those clinics. So I know that there has been some queues that have developed over the weekend in some of those clinics, and I thank the people who persevered and got themselves tested. That is really, really important. I strongly recommend that people go onto the website and look at where their local clinics are. because we're tending to see people go and preferentially choose 1 or 2 clinics when there are a lot of clinics available, both public, private and Commonwealth clinics. So it's really important, just look at what the options are, because there may be very lengthy queues at one clinic, but then no queue at another clinic. So if people could do that, that would be very important. For those people who, for whatever reason, don't have access to the internet, for instance, they might be visitors from Victoria, then you can always ring 13 Health 24/7. That's always available to anyone throughout Queensland, and they can provide advice. But the best option is to just go on the internet if you've got access to the internet. So if I could just reiterate, this is a difficult time across Australia as we're seeing these ongoing outbreaks in Sydney and Melbourne, but they are doing a lot of work to bring them under control. But we just have to be very, very alert. So please, if anyone has any symptoms at all, come forward and get tested and isolate yourself from your family and from other people till you get a negative result. That's really important, and I've always said if we can find the first case in a cluster, we'll be able to get onto it so much quicker, rather than finding the cluster 2 or 3 generations down the track. Thank you.
Any questions for myself or Dr. Young? Well, Queensland is doing its bit. We've always done our bit to support returning travellers, and we'll continue to do that. And of course, if any decisions are made at a national level through the National Cabinet, we'll of course comply with those. But Sydney and Melbourne have always been the big international gateways to Australia. But we do our bit in Queensland, and we'll continue to do that. Well, we'd have to, of course, manage that very carefully. We'd have to ensure that we did have the capacity to manage any increased numbers, and we need to be very careful about that as we balance the need for tourism, the need for hotel rooms for returning Australians, of course, and returning Queenslanders. So we have to give that priority, make priority decisions around that, and of course we take the advice of the Chief Health Officer if we were to make any further decisions to take any additional people returning to Australia.
Why has it taken 2 days to open extra clinics that extend hours?
No, we've actually been extending the hours of clinics. Additional hours last night, I know, at the Gold Coast, and of course standing up more capacity as we deal with the number of Queenslanders and others who seek to be tested in our state.
Well, then I'll rephrase. Why did it take until last night to extend hours when there were huge lines of up to 7 hours, particularly outside Gold Coast?
Well, I understand, I'm advised that hours were extended, staff were put on to ensure that people could be tested as quickly as possible. And we're now going to ensure that continues to be the case as this week rolls out.
Is 7 hours acceptable?
Look, I don't want anyone to wait, but the reality is Queenslanders have responded to the call. That's just the reality. They've responded in very significant numbers to do the right thing. And we are providing the resources that we need to do as a state to ensure that they can be tested as quickly as possible. I want to thank them for that. They've done an extraordinary job to ensure they can be tested, and that will keep not only them and their families safe, as I've said, but it'll keep our state safe. And I want to thank them so much for coming out in such significant numbers. And we've now got those 83 clinics operating, 23 in the southeast. The Commonwealth has stood up their clinics, which weren't operating. And we're very pleased that that's happened as well. So we're going to continue to provide those resources to ensure people can be tested as quickly as possible.
Is it possible that there was perhaps not enough communication until we heard from Dr. Young yesterday? We haven't had a lot of press statements or things in recent days. We had those big lines of those requirements for those from Victoria and New South Wales were put in. Do you think perhaps there wasn't enough visibility or communication about those other clinics that led to those lineups and the 6% narrow wait?
Look, I mean, we can speculate on that. We know there was a surge in people wanting to be tested, and we wanted to ensure they could be tested, and we put those resources in place to ensure that can happen.
Do we know how many more tests from the Gold Coast states
How many more? Big pardon?
How many more clinics are open on the
Did you
Gold
want to answer that, Dr. Young? I might let Dr. Young comment on that.
So 3 additional clinics have been opened on the Gold Coast, and all their current clinics have had their staff numbers doubled.
Dr. Young, are you aware that at the Bailey Henderson Hospital in Toowoomba that patients are swabbing themselves?
No, I'm not aware of that. People can swab themselves, so we do have processes out there that we've been working through, that for some people it can be quite traumatising to have someone insert something. So we have worked with certain groups who've had particular problems so that they can swab themselves. But that's done under clinical supervision. So I'm not aware of that particular case, but it could well have happened. It would happen under clinical supervision.
Why would that happen?
As I say, I don't know the particular incident you're referring to, but we know there are some people who, for various reasons, through previous trauma, through other reasons, just can't manage with someone inserting an implement into their nose. It's just very traumatic for them. And also for very young children, we find it's best that perhaps their parents do it rather than someone else. So it's always a clinician who's involved with swabbing someone, and they work out what is best for that person in front of them.
In theory, why would it happen on a large scale?
Sorry, what was
I
that?
said, in theory, why would it happen on a large scale if everyone in the line is being told to swab themselves? Is it for efficiency, or why has that been introduced previously?
We do have it in place in some areas of the state, and initially it was done to manage our PPE supplies. If you remember early on, there was quite a worldwide shortage, so we did some work to work through whether it could be done, so we did some assessment. So in some places it might be happening. But this is a clinical decision made at the time, working through with the patients who are there in front of them.
Dr. Young, you spoke yesterday about your negotiations with Cricket Australia and the government test. Is there any update on that today?
No, I don't have any further information, but I understand that all those discussions are progressing very well.
Do you feel you've done everything you can reasonably do to make the Indian side welcome with the requirements that we require here in Queensland?
We've just been very clear what those requirements are, and we don't make any apology for those requirements. They're in place so we can keep Queenslanders safe, but still allow the match to go ahead. And we've had a lot of experience in that now. We've had multiple different sporting codes very effectively manage the season here in Queensland. So we're fairly experienced at it now.
Given our requirements regarding the GABA test, do you think it's irresponsible that the New South Wales test is going ahead during the middle of an outbreak?
I understand. Yeah, I understand they're putting in place additional requirements, and I believe, if they haven't already, that they'll be making that statement this afternoon.
How much is frustrating Dr. Young to see those players that kind of went out in public into the restaurant, and I believe it's actually quite close to where there was a case, given they are going to come to Queensland then, where we obviously have very strict rules. Does it frustrate you to see that?
Well, it doesn't make any difference because we have our rules in place to protect for exactly that reason. So I think it must be frustrating for the organisers because then they increase the risk of someone having a case, but in terms of us it's the same requirement. So we've got people in quarantine at a hotel, and the only reason they can leave is to go to the GABA for training or a match, and they're not to come into contact with anyone else there. So it really doesn't make any difference to our risk what they have been doing in interstate.
We've heard from a Queensland family who's got a couple of the reasons to travel to Vietnam and pick up a new performance roller. They then left in December, travelled for 18 days directly back to Cairns, had ABF approval to dock in Cairns and was denied exemption to quarantine either at home or on the vessel there. Why would that be the case, given the earlier case in December where we had a super yacht crew that members quarantine on board there? Is there a reason?
Right. Super yachts boats, I understand, but it's possibly a question for MSQ, Maritime Safety, need to maintain a skeleton crew for the safety of the vessel. So, with their advice, they said that 6 people needed to remain on that super yacht for the safety of that vessel, so they remained, and they were in strict quarantine and were tested on the yacht. Whereas other boats don't necessarily need someone to maintain, they can be safely anchored, and the people then go on shore and quarantine in a hotel. All the other people on that super yacht had to quarantine in a hotel. They weren't able to stay on the super yacht. So that's the difference between the two. It's really then the advice, and I'm very, very grateful to MSQ. They've been amazing to work with, and we take their advice every single time about, for safety reasons, who needs to remain on a vessel.
Do we have any further updates, I suppose, on that? Maybe
Yes, they've all completed their quarantine, so they're all free to go about their business.
Just a quick question about for our Mackay crew. So one of close contact with someone that was tested positive in Victoria is in Mackay.
Yes.
Does then their close contacts, so the close contacts of the close contacts, do they need to quarantine, or what's the protocol with that?
It depends. So every single time it's an individual assessment. That's what the public health units have been doing every day now, nearly a year. So they're very, very good at it. And they just assess the amount of interaction and whether or not we need to quarantine that whole household. So there have been times when we've done that, when we've really been concerned about an outbreak. We did it, for instance, with the Brisbane Youth Detention Centre cluster. We started quarantine contacts of contacts. Other times the risk is very low and we're quite happy for them to continue to go about. So it really depends on the situation. So that individual there tested negative, which is a very good thing. And then I understand that there is one household member who's in quarantine as a result, but that would have been determined by the local public health unit.
And when you gave that directive at 3 o'clock that all Victorians needed to get tested a couple of days ago, what was the communication from you to the authorities to stand up extra clinics? Did you say we need to stand up these clinics, and when did you say that?
Yep. It wasn't a directive. It was advice, and I'm very, very grateful for all of those people who've taken that advice and who've come forward. Now, I did put the hospital and health services on notice before the Christmas New Year period because I was very concerned, because normally more than half of our testing in Queensland is done in the private sector. And then you also have the Commonwealth sector. So I knew that there would be an increased load, so all of the hospital and health services across the state had surge plans in place to cope with that exact incident that then occurred. And then I'd been meeting regularly. In fact, all of our hospital and health services meet every single day, 7 days a week, and they're kept informed, of course, about what's happening across the state and what potentially is going to happen. And then I met with all of the chief executives personally on Thursday morning. So we have those regular meetings. Of course we do, and we share information, but it was just a situation that there was a lot of people who came forward, which was very, very good, and the public sector had to manage that without the assistance of the private sector, which they did exceptionally well. So there were a few clinics that had extensive waits, but there were other clinics that had no waits, which is why I really and truly stress to people, please, could you go on the website and look at all your local clinics and then make choices? We seem to have some clinics that, for whatever reason, are much more popular than other clinics. I assure everyone that everyone has good testing processes and is very capable of doing the testing.
There are reports of incoming interstate travel being bussed from the Sunshine Coast to Brisbane due to the lack of hotel quarantine accommodation. Is there a shortage in regional areas?
We have concentrated the hotel quarantine for various reasons in Brisbane because it is quite a complex process, and I've now required anyone who's working in those hotels and has contact with people to get tested every 7 days, which is another impost. So I would far prefer that an entire hotel is used for hotel quarantine. Earlier on, we just had hotels that 1 or 2 floors were being used, and I think that that's too risky now. So it's really about the risk profile has changed. You would have heard earlier that we had 5 positive cases overnight. All of those were in Brisbane and the Gold Coast. And I think that we can see that the risk from overseas is continuing to escalate. So we have to be very, very careful with our hotel quarantine. We've now seen breaches in many of the other states and in New Zealand and elsewhere. So we just have to be so careful how we manage our hotels that we don't get any breaches.
Just on the testing numbers yesterday, that figure, Dr. Young, is that an amount that's on par that you would have expected from the queues that we did have that you would have seen, I'm not sure, social media and things like that, or is that the number you're probably expecting if they're given how many people have rushed to get tested?
Well, people who turned up all got tested. There were a few who were asked to come back the next morning. And they came back early and had booked appointments, and that worked very well. But yes, everyone who turned up got tested.
Given that you're concerned about hotel quarantine and that sort of thing, do you have any details about the 17 active cases, which countries they're from? Is there one particular country or one region of the world?
No, there isn't. A lot are coming from the UK, but that just depends on the flights. So if you think each day we only get a limited number of flights from overseas, so that's where we're going to get the cases that day. But we've seen them from all parts of the world. We've seen them from Europe, from India, from Pakistan, from Asia, from everywhere in the world. So really we can't go and stratify and some places are higher risk than others. Anywhere overseas other than New Zealand and some of those Pacific islands are really of high risk, and we need to then manage them. The other thing is, of course, people transit through other countries, so we don't always know where they originally came from, which is why it's critical that anyone who comes from overseas, except for those people coming on green flights from New Zealand, do need to go into strict hotel quarantine and need to be managed there.
Given that there's so much pressure on testing clinics in the Gold Coast, there'll obviously be pressure also on Gold Coast pathology services. Is there anything in place to try and mitigate that?
Yes, so the Gold Coast University Hospital has quite a large capacity already, but they can always overflow to the central lab here in Brisbane if there's any issues at all. That's not a concern. So public pathology is managed as a network throughout the state.
And can I ask can you comment on the situation in New South Wales regarding the Test cricket? Are you concerned about that, given that they're allowing spectators during the middle of?
No, I'll leave that to the New South Wales authorities to determine how they handle the test in New Zealand. We're of course working hard to ensure the 4th test takes place here in Queensland as probably one of, if not the biggest cricket tragic in the Queensland Cabinet. I'd love the test to go ahead, but our number one priority as a state, which was in our economic recovery plan, which is embedded in our budget and which is now the number one priority of the government as part of our government priorities for the next 4 years, is to safeguard the health of Queenslanders. That trumps everything. We want to make sure Queenslanders are safe and stay safe, and that will be our priority, and we'll take the advice of Dr. Young as those preparations are made.
But at this stage, the GABA test is likely to go ahead?
Yes, we're still working on that basis, and we're of course working with relevant cricket authorities here in Queensland, Queensland Cricket and also Cricket Australia to ensure that can take place. All right. Thanks, everyone.
What would it cost the state if we lost the test again?
Oh, I don't have those figures. I'm not aware of that. All right. Thanks, everyone. Thanks for coming along.